So thank you so much for being here tonight. It's truly an honor and a pleasure for me to be able to share this webinar with you on end of life advanced care planning. And I am just going to see if I can turn off my camera because I'm distracted by that. Okay. All right, there we go. Did you realize that April the 16th is National Healthcare Decisions Day? Our conversation this evening has perfect timing. You know, perhaps you've joined us tonight out of curiosity. Maybe you're wondering about advanced healthcare planning. You might be more focused on related concerns to end of life care. Perhaps you're here because you've had an experience where a person's living will or advance directive was honored, or maybe not honored. Maybe you're curious about advanced planning for funeral services and commemoration at end of life. Maybe you've been approached by a funeral establishment or organization for pre-planning, or maybe even for prepaying your funeral expenses. It is my hope that whatever your reasons are for being here tonight, our conversation will touch upon those areas that are most important to you when it comes to thinking ahead. These conversations about advanced planning are really about end of life planning. The industry paints a gentler picture when they talk about making your wishes known, but what they're really talking about is what will end of life look like for you or your loved one. And this certainly can be a sensitive topic. Many people prefer to avoid considering end of life concerns altogether. Maybe you've thought of this before, but maybe you haven't. Maybe you have had this delicate conversation with a loved one, maybe with an aging parent, maybe with your own partner or your spouse. It is also possible that you're here tonight as a paraprofessional, meaning that you serve in an industry that provides care for people at end of life. These conversations are best held far, far in advance of the time of need. My hope for you tonight is that you will, at the very least, begin to think about this important discussion, if not for yourself, for the people in your life who love you. And I'm also hopeful that you will see how planning ahead does become a final act of love for those that you care about the most. Tonight, our objectives are going to be talking about initiating and navigating difficult conversations, different kinds of advanced healthcare directives. We'll touch on leaving a legacy of your life story and your personal philosophy. We'll talk about final rites, like funeral planning, that help loved ones to find peace. And we will talk about funeral services and pre-planning. This is also a good time for me to say to you, please seek the counsel of your own personal physician or attorney when it comes to matters of advanced care planning. This webinar in no way replaces medical or legal counsel from authorized and licensed professionals. Tonight, our talk is all about the why behind advanced care planning. And I'm hopeful that it will also inspire each of you to take personal steps to meet your own personal needs in this regard. But let us just take a moment right now to acknowledge how deeply personal and moving this subject really is or can be. If we were all together in person in the same room, I would invite you right now to partner up in small groups. But for now, just take a moment to reflect upon an experience that you may have had with someone at the end of their life. What was that like for you? Was it in a hospital? Was it in a private residence? Was it expected or was it unexpected, maybe a traumatic event? Were you involved with making decisions regarding goals of healthcare? Was the person able to make their own decisions and wishes known? What was that experience like for you? Was it emotional? Did you feel detached from it, or was it intimately contributing to your emotions at that time? Looking back on these types of scenarios might bring up feelings of sadness or grief, no matter how long ago that experience might have been. Losing someone that you love, or even an acquaintance with whom maybe you were not so close, could leave you with many strong emotions. Tonight, however, our focus is not on grief. Our focus is on easing the way, not only for ourselves, but for the people that will be in charge of our care when the time comes. You see, death is an inevitable experience of every life. Everybody eventually dies. How we get to that point, how we experience moving through dying, death, and grief is something that we do have the ability to prepare for. We can choose to make some simple decisions and planning ahead for that inevitable time. In doing so, we can then also allow the focus to be on comfort, on ease, and on grace when the time does arrive. Over the years as a healthcare chaplain, I've had many opportunities to engage in these difficult conversations. Sometimes people are more open to talk with a stranger about these things, even more open than they are with their closest family members. But it's not an easy discussion. Our society truly has a phobia when it comes to the matters of death and dying. How many times have you heard someone say, "Oh, let's not talk about that right now," or "if I talk about it, it might happen sooner," or how about, "Never mind, when the time comes, you'll know what to do," and yet you may in fact be totally clueless about what to do. And then there's the one who says, "Everything that you need to know is in my legal papers." But where are those legal papers kept? And is the part about healthcare decisions front and center, or is it buried somewhere in the depth of a very long document? Well, to begin with tonight, I would like to bring your attention to the Riverside Medical Clinic Charitable Foundation website. I know that these links will be posted in the chat, but it's also here on the screen if you want to jot it down or even take a screenshot with your phone. If you follow the link for tonight's webinar, it will also take you to a page for frequently asked questions and an actual advanced healthcare directive form. The frequently asked questions is an excellent place to begin if you're not sure what an advanced directive is or some of the legal talk around this subject. But this is one of the many fantastic sources to discover more information on your own. This form on the screen right now is offered through the Charitable Foundation, and it's an actual legal document that can be used in the state of California. But tonight, I want to let you know that some states in the US have different requirements. So this form may not be portable to another state. Check ahead. If you're traveling or plan to stay somewhere outside of California for an extended period of time, it's a good idea to look at the laws and requirements of the place of destination. For right now, and for the most part, even as we acknowledge that this form and other forms like it are a legal document, the act of filling out the form and making decisions in and of itself can be very helpful. That conversation we were talking about. For example, consider, who would you entrust with making the important health decisions on your behalf if you weren't able to do so? What would you want that person to know? And how would you want to be treated in the event that you are unable to communicate your needs? Have you considered what types of long-term therapy you would want if it was needed? Or what about short-term life-saving interventions? The person that you designate as your decision maker is often referred to as your agent, who will make healthcare decisions for you or who will communicate your wishes on your behalf in the event that you're unable to do so. For the purpose of our discussion this evening, rather than focusing on the small details and legalities, we're just going to focus on some general terms. This conversation is hopefully the beginning of many conversations that you will have on this topic. And if you are interested in more in-depth information on advanced healthcare directives, living wills, or durable power of attorney for healthcare, the Charitable Foundation website is a great place to start. Consider that what we know as quote unquote life support may involve the use of medical devices such as a ventilator, pharmaceutical interventions to maintain vital functions such as cardiac rhythms and blood pressure, or life support could also include various apparatus such as tubes for feeding or tubes for drainage. If you knew that you had a terminal illness, would you want the medical team to pursue therapeutic measures to prolong your life? Or would you want for your agent to know that you prefer to be kept comfortable until your final breath and to allow a natural death? These are really important things to think about. But perhaps more importantly, these are all critical ideas to speak with your agent about. If there's nothing else that comes from this evening's webinar, it's my sincere hope that you will begin to consider your wishes and that you will speak to your caregiver about those decisions. As a hospital-based chaplain, I have witnessed many times where family members simply did not know what to do. I saw how they struggled with concern and even guilt about decisions that they were forced to make. And of course, no one ever wants to give up. And as long as there's someone in authority, such as a physician or a surgeon, encouraging you to keep trying, of course, we defer to their expertise. However, under what circumstances is it necessary to realize that nothing more than a miracle can change an inevitable outcome? I can share with you, I've also been with many people who prayed fervently for that miracle. But sometimes, just maybe, the miracle is that suffering has ended and the person who has endured a terrible medical crisis or disease is now free of pain. You know, I'm not here this evening to explore the existential and spiritual issues related to end-of-life decisions. That would be a whole other webinar. Instead, I'm hopeful that this conversation will simply encourage each of you to consider your own unique circumstances and wishes. An advanced health directive is one way of making those choices known. Choosing the right person to enact those directives is a very important part of your planning. You will want to be sure that whoever you choose is in agreement with your plans and will uphold your wishes. There's one other type of advanced healthcare directive that I want to mention this evening. This is called the Physician Orders for Life-Sustaining Treatment, referred to as the POLST. This form is designed to be easily identified by its bright pink color. It's portable because of its short length, both front and back, and particularly with individuals who have certain needs. Those needs might include chronic or terminal illness. The POLST is legal in the state of California, and it's designed for a person who may, at some point, require emergency assistance to manage life-threatening symptoms related to a medical diagnosis. For example, a person who's on hospice care for a terminal illness, or maybe they have a chronic condition, that person may have a POLST. The post also designates the spokesperson or the agent who will be acting on behalf of the person who is unable to make these decisions themselves. It's important for you to know tonight that the post is not necessary for everyone. It does not replace the legal form of an advance directive, but rather it complements the form, and it can be easily used in the time of an urgent response to a medical emergency. One thing that I cannot emphasize enough is that these discussions ought to be held with your personal physician. Doctors can and do offer appointments specifically for advanced healthcare planning and documentation. So ask for that appointment with your doctor. And I also refer you to the Coalition for Compassionate Care of California if you want more extensive information about the POST form. It also has a lot of really good information about things like life support, feeding tubes, CPR, and things like that. You really don't have to and really shouldn't do this alone. I really want to invite you to involve your physician, consult your attorney, and most importantly, make sure that your loved ones know what your final wishes are. In hospice care, I have the distinct honor and privilege of walking alongside of people and their family members who have been given the prognosis of 6 months or less to live. Oftentimes, there's a rich opportunity to engage in life review and storytelling. I've had the gift of hearing thoughts and reflections that perhaps no one else in the whole world has ever heard from the person who's near the end of their life. When it's appropriate and when the person is able to, I encourage and facilitate various life legacy projects. One such method is creating a legacy journal based upon the philosophy and stories of Dr. Harvey Max oh my goodness, I can never pronounce it right. Please forgive me. Dr. Turchinoff developed what we call dignity therapy about 15 years ago. And in a series of scientific studies and peer-reviewed publications, the method developed by him involves a certain list of specific questions. And the patient or the person who's being interviewed is invited to reflect on their answers while the therapist literally tape records them. Those answers are then transcribed and presented in a document. The Veterans Administration also has a similar project called My Life, My Story, and it offers a framework for listening, recording, and sharing life's most important reflections from someone who might be chronically ill or even near the end of their life. Like dignity therapy, My Life, My Story provides a transcribed and written document that the person can share with their survivors. But legacy does not necessarily have to be in the form of a written document. A collection of photographs, a booklet of favorite recipes, family videos, and special gatherings all become ways in which a part of us is left behind. You might make art together, crafts such as handprints and personalized drawings or greeting cards. Recording the voice of your loved one with a heartfelt message to be heard in the future is also a really beautiful gift. But tonight, I just want to convey to you that simply sharing a moment of presence, a time of quiet and calm in the midst of all of the medical chaos, may be the very best memory that a person can keep. Facilitating that soul work, SOUL, soul work, for someone, that may be the most important thing and one of the most rewarding things that you'll ever do. So, a word about funeral arrangements. Ask questions, talk about it, write it down. Helping the people that you leave behind To know how to honor you is extremely important. It's so important to know that the agent designated on your advanced healthcare directive will also have the authority to make decisions about what will be done with your body after death. A lot of people don't realize that. If these considerations are not specifically documented by you, then the agent will have the responsibility of making the final arrangements. The topic of pre-planning or even prepaying for final arrangements is very extensive. Another whole webinar. But for our conversation today, I simply wish to convey that it's important to think ahead. Consider those who survive after your death and know that they need to know what your wishes are for final care. They need to know how to handle it. You can't just say, oh, it's up to you, do whatever you want. Listen, if anyone is interested in more detailed information on after death care, I would be more than happy to speak with you from my perspective as a licensed funeral director. But for now, for today, just please know that this is a very important component of your advanced planning discussion. When we are able to deal with the most difficult questions and face what may possibly be the most difficult scenarios, we can then move into considering how to make the experience as comfortable and as peaceful as possible. Planning ahead in these ways does indeed become a final act of love. Here are a few helpful resources, and I know that Alina will share this slide with you, but I do want to invite you to feel free to reach out to me. You can call, you can text, you can email. I'm more than happy to speak with you one-on-one and address some of the questions that you might have. So now I'm going to stop sharing my screen and turn things back over to Alina.
Thank you so much, Carolyn. I'm just going ahead and I'm going to place in the chat some of those links that Carolyn had on her last slide, as well as her email address and my contact information as well. But again, you will receive a follow-up email with the recording of the presentation tonight and the PowerPoint slides themselves. But I just want to take a moment and thank Caroline so much for truthfully just making a difficult subject matter. I don't know about you all, Donald, Melanie, there's some people I recognize, Angela, Sydney, but after I hear Caroline speak, I'm relaxed and I feel safe and I feel at peace. And I think what you're trying to convey, Caroline, which I feel that you did, is, pre-planning allows us to have these small moments of just grace and beauty and in what's just a really hard time, a time that nobody wants to go through, nobody wants to think about. So for me, your presentation kind of is a metaphor for doing these things of planning ahead. Because as you pointed out, you can and you should plan ahead, and it will make it a different experience. So I wanted to thank you. I want to invite anyone to please ask questions. If you want to, like I said, put it in the Q&A, but I'd definitely be happy to read your question out loud. Or if you're comfortable, you can let me know in the chat and I'd be happy to unmute you. And if you want to ask a question directly, we can do that as well. Let me let me see here. We have some comments. Let me read them out loud. So we have somebody here said, when you choose one of your children as your agent, how do you tell the other child without hurting their feelings? That's a great question, Caroline. Can you talk about?
Yeah. Well, let me say that's a very, very common experience among family members. And oftentimes I hear people share with me that they chose one particular adult child because they know that that's the person who's maybe most organized. Maybe they're most resourceful. Maybe they will be the most calm and able to navigate through a very difficult and emotional time. Sometimes that's the only reason why you designate one person. And in fact, my experience both in acute care, in a hospital setting, in a trauma center, and also in hospice care, where the end of life is expected and there's more time. My experience has always been that um, there's always one person who rises to the occasion. There's always one person who is really and truly the most equipped to be able to handle such a difficult life experience. And it's really okay for you as a parent to choose them. But let me tell you what happens if you don't. So I mentioned to you that I continue to hold an active funeral director's license, even though I'm not working as a funeral director now. But during the time that I worked as a funeral director, after the death was when there would be the most difficult conflicts among family members. That was the time when family dynamics were heightened, whether they were good dynamics or not so good dynamics. So, all of that to say that by designating one person, you are also making them the power broker, the one that's going to calm the situation and basically guide your whole family through the experience. So I hope that helps you. And I would encourage you to, just really reflect on that and talk to all of your children about your decision.
Thank you for answering that question so well. But we do have a comment that says, "Thank you for your compassion, Caroline, and covering such an important topic." So thank you so much. Um, if there are any questions, please go ahead and let us know. Again, if you would like me to unmute you and you want to ask something specific, or of course, you can follow up with Caroline, maybe if it's a more of a personal question and situation, and she has graciously offered to answer your questions. Looks like somebody asked, they say, "Thank you, this is very challenging." Yes. And then, do these forms expire?
That's a really great question. And the answer is that when you create a new advanced healthcare directive, it automatically cancels out the previous one. But they do not expire. So if you have one from 5 or 10 years ago, it is still effective and it is still a legal document. And this is why it's so important. At least once a year, do it on your birthday, get out those forms and look at them and check in with yourself. Maybe your health situation has changed. Maybe your family system has shifted. There could have been some changes in your family. There could be any number of reasons why you might want to update it and change your preferences.
That's a great question. Thank you. Again, I want to clarify the link. I'll put it one more time. The link that I'm putting in the chat takes you to our website page on the Riverside Medical Clinic Charitable Foundation. It's a mouthful. It takes you to our website. And if you scroll down to the bottom of our page here in the chat, you're going to be taken to forms from the Riverside Medical Clinic. And again, you can print those out. You can look at the FAQs. So I put that there one more time. We have a couple more questions, and then I have a question as well too. So does the POLST supersede the medical health care directive, or are both considered?
Both are definitely considered. The POLST is intended to be sort of a complement to your advanced healthcare directive. So it's really important when you're filling out a POLST, which is actually done with your doctor or with their nurse practitioner. Nurse practitioners are allowed to facilitate those conversations in our state. But when that's done, that's also a really good time to get out your advanced healthcare directive and make sure that it's in alignment. A lot of times doctors will encourage people to have a pulse if they have certain conditions that might lead to an emergency hospital admission. For example, maybe a cardiac condition where at any given time a person might require, a call to 911, a situation where it's an emergency. That pulse is something that all first responders, all healthcare providers in every milieu, hospitals, urgent care, nursing homes, whatever that may be, they recognize that as a universal doctor's order, and they have to honor it by law. So let's say this is a person with a cardiac condition, and let's say this person really doesn't want to have CPR if their heart stops. The pulse will give that order by a physician to do not resuscitate. But it also talks about other kinds of life-saving measures and long-term care like feeding tubes or being on a ventilator. It's all things to talk to your doctor about, and it's really important to have that conversation.
That was a great question. Thank you for asking that and answering that. Somebody noted in the chat, once a year is more often than I thought. Thank you when it comes to looking at the paperwork. So thank you for that. And I had a question just because, whether somebody that's joining us tonight or now that this type of material, which is really needed, can live on forever on YouTube, if someone comes across this and finds this really helpful information, maybe they're in that season of life where they are expecting someone's, passing. Being that this is like what you do every day and this is your, your calling, I like how you called it soul work earlier. How do you just allow for self-care, and how can a family that's going through that type of time, like really just bolster themselves and just help themselves through this time?
A really, really important question, Alina. And, this is where our relationships with our close friends and our family members who we love are so important. And cultivating those relationships, and especially, with one or two really closely intimate, trusted friends that you can go to and tell your story of grief, of anxiety, of whatever it is, whatever emotion, deep sorrow that you're experiencing is so important. I see, as a hospice chaplain, I see a lot of people who are the primary caregiver, and it's really hard. It's really very hard. Sometimes they're in situations that they never dreamed they would be in, watching their partner, their loved one decline, and their needs for daily care increasing, and having to do things that maybe they never had to do or never thought they could do before. So it's just so important to really lean on whatever resources are available to you. If your loved one is on hospice care, lean on your hospice team. They have lots of resources to help you. They have caregiver support groups. They have grief support groups. They have social workers that can help you find extra caregivers if you need it, or if you need funding, if you need to apply for, like for instance, the aid and assistance benefit from the Veterans Administration, things like that. But lean on others and not onto your own self. That is so important.
Thank you so much. And then lastly, I wanted to ask you, Caroline, if there's certain books. I know that you did share in your PowerPoint the end of life. What is it? The dignity.
Right. Dr. Here I go again. Chochinov's book. That's actually a psychology textbook, and so I wouldn't recommend that to a lay person. But suffice to say, it's designed to help a person who is in a therapeutic relationship facilitate dignity therapy and create what I call a legacy journal. So there's a lot of resources available on the internet. I did list the websites for the dignity therapy work as well as the Veterans Administration work. There are many books available, but here's one that a lot of people don't even really know is available, and it's free. And this might sound a little bit cheesy, but go to your local mortuary. Most of the time, the manager, the funeral establishment owner, or the manager will have a guide for you, and it'll help you to, go through all of these things that we're talking about. There are many of those available, and just go to your mortuary and ask for one. But be careful; they might try to sell you a casket.
Oh my gosh, that's so funny. I definitely wouldn't have thought of that, but it's something that makes total sense. Of course, they would have something like that. Thank you for sharing that. Okay, well, I want to just give just a couple more moments to give an opportunity for somebody to ask any additional questions. It looks like somebody raised their hand. Donald, did you have a question that Caroline can answer for you? I don't know if I should take that as you want to ask a question over audio. Can you go ahead and let me know in the chat, Donald, if you have another question?
While Alina's waiting for Donald, I want to mention to our viewers, our Advantage Hospice and Home Health, I've developed a document. It's really a brochure that's entitled What's Next? And it talks about a lot of different things like working with the Veterans Administration for burial benefits, working with the county medical examiner, where to order death certificates and why you might need them. And it also includes a list of licensed funeral establishments in the county of Riverside, plus a few from San Bernardino. So if anybody's interested in that, please feel free to reach out, and I'd be more than happy to send that to you by email.
Thank you so much. Okay, I've not heard back from Donald, so I'm gonna just briefly see if I can unmute and see if we have a question. Hi, Donald.
He's still muted.
Okay, is that better?
Okay.
Can you hear?
Okay.
Yes, we can hear you.
Oh,
What's your
thank you.
question?
Hi.
No, it wasn't so much a question, but you mentioned that if you went to the funeral home and someone would try to sell you a casket, they do pre-need. Most of them have pre-need services, and that's where well, you know what pre-need is, but so many people don't know what pre-need is, and they think that if they buy it today, they got to use it next week or next month. And I first learned about pre-need in 1957 when my grandmother passed away, and my mother had to go and to my grandmother's apartment and find out, get all the papers. Well, my grandmother had 3 plots that she had bought in this cemetery. And she was a woman alone. and one was used in January of 58. The next one was used in 2003, and the third one was just used last year. So just because you have pre-need care does not mean that you have to use it right now or right away. That's why some people are afraid to go and talk to them.
But it is helpful. And I think it also kind of tends to take your mind off of gee, what all do I need to do? There is so much to do. So that is one of the things that is helpful. And, you know, as you said, the mortuaries are very helpful. They're willing to answer the questions and, you know, talk with you and kind of lay out everything for your choices as far as right then. But it's just, you know, it's just another thing that's good to know. And thank you so much, Caroline, because this just keeps kind of reminds us, especially as we mature in age. And we just this past 4 days ago, we attended a service. So, and this was a longtime friend. So, you know, these are things that are coming about, especially with the pandemic, that people are coming in contact with, maybe never even thought that they would need to, but maybe they've had to, you know, have it touch their lives once or more than once, you know, in this past year, especially. Well, thank you again.
Absolutely. Really important points. Thank you so much for speaking that into the room. You know, a lot of people, like you said, there's a little bit of fear about thinking about that. Like if I start thinking about it, it might happen, right? Some people are superstitious, but you know, the truth is that you know, you could go to a funeral establishment and those are very professional people who will gladly answer your questions. It's not mandatory to prepay for your arrangements, but you certainly can have a discussion about what you might want to do when the time of need comes. And I would encourage you to think about those things. Thank you so much.
Thank you so much for those comments. Yes. And then it looks like Ms. Sydney, did you have an additional question? I know that you put in the chat. We'll make sure that you receive a copy of the brochure. So we'll follow up on that. But did you have a question that you wanted to ask over audio? If not, that's totally fine. So it looks like we're about through. Thank you again, just everybody for your questions. And again, there will be an opportunity if something comes to mind. Feel free to email myself and I can connect you with Caroline. But then you'll also be receiving more resources to you via email. So you can take some follow-up action and definitely look at the documents that, that is already prepared for you to use. So thank you again so much. And real quickly, I just want to share just a couple of things on for our foundation because we love connecting with you all through our support groups. We have, once this webinar comes to an end, you're going to be redirected to a page on our website. We have a virtual support group bingo night later this month on April 22nd. So if you are a current support group member, or maybe you're new tonight and you want to learn a little bit more about, you know, our foundation and honestly just have fun and play some virtual bingo with us, we give away prizes. You are invited to join us. So again, when you exit out here of this webinar, you'll be taken to that page so you can check it out. And if you want to RSVP, you're welcome to do that. And then also we have many additional support group webinars coming up. We have one next Thursday on the warning signs of Alzheimer's. If that's relevant to you or anyone you know, we have a lot of different ways that we can support you. So I invite you to check that out. But again, thank you so much, Caroline, for your time. We definitely appreciate you doing these 2 wonderful webinars with us. Oh, I also wanted to share actually the link for the previous webinar that you did with us, which was just more on grieving. And that's related to anybody that's lived through this last year. So I'm sharing that in the chat as well. But thank you so much. And I wanted to ask you if you have any final words for us before we sign off tonight.
I just want to thank you for the invitation, and it's just wonderful to be with all of you tonight. Thank you for your time and many blessings to you. Thank you.
Thank you. Thank you so much. All right. Take care, everybody. Have a great night. Go hug the people that you love.